I completed my master's and doctorate DNP degrees at the University of Rochester. I'm alumni of 2011 and 2013. And Dr. Jane Tuttle, who's on here, was my PI and my program head director. So I had a great experience during that time, and I'm currently in New York City. Excuse the noise in the background, we're mowing the lawn, but so I'm in Queens, New York, and I'm an assistant professor at Long Island University, and I'm also a clinician at Northwell. So I welcome all of you guys, and as you already know, National Nurses Week is in celebration of nurses, typically May 6th through May 12th, and it ends on Florence Nightingale's birthday. So this is, given everything that we've experienced with this pandemic, being frontline nurses, having to make rapid changes overnight and being redeployed or getting out of our comfort zones, being there for families, being there for patients, and also learning new things, right? Learning new skills right on the drop of a dime. This is exactly epitomizes the work of Florence Nightingale. And it's amazing how all these years later, we're really doing the same thing that she did during her time in her nursing profession. So the School of Nursing would like to acknowledge 2020 was the year of the World Health Organization International Year of the Nurse and Midwife, and want to continue that recognition through this year, recognizing frontline nurses and all the hard work and dedication and loyalty to this profession. And also, in addition to that, we also want to keep in mind the nurses who have passed away in the fight against COVID. We want to honor them and recognize them and keep them and their family in our thoughts and prayers. So for the overall objective of this event is to go over, to have a discussion on our reflection on the pandemic and new experiences, what are new key observations, and what are some silver linings that we can take into the future, right? Because we know that healthcare is going to look different, but there are a lot of positives that did come out of these dark times, and we want to emphasize that as well. We also want to increase engagement with and financial support for the School of Nursing. So nothing we do is not made possible without our supporters and our donors, from redesigning the School of Nursing, reimagining how we deliver academic services, right? Support services to our students, and also other things like scholarships, supporting underprivileged students and minority students as well, to have the same opportunity to accomplish goals. So new research and new technology all comes from your support and your funding. So we really encourage, and we'll go over that at the end. Our speakers today, which we're gonna have them introduce themselves a little bit later on, but just to acknowledge our speakers today are our alumni. We have Mary Starks, class of 2017, and she's URMC OR nurse. We have our family nurse practitioner, Dr. Sue Griffey, who is class of 73. And we also have Sean Goonan, who is assistant nurse manager, class of 2011. So just some housekeeping items in the beginning. This is later on, we'll have a Q&A session, and you'll have the opportunity to ask questions, and we'll also ask you questions as well. We want to make sure it's engaging. And so please, when you're not speaking, please just mute yourself. Remember, this is a recorded event. And throughout the program, you can also submit your questions in the chat, and we will acknowledge them at that time for Q&A. We also want to acknowledge the diversity of the people, of all the nurses, friends, family, donors, everybody, our supporters who are here today from different areas. Like I said, I'm from Queens, New York, and we also have Maryland here. We have nurses from North Carolina, Chicago, and also from our Rochester area, Wilmot Cancer Institute, Golisano Children's Hospital as well, and Strong Fertility Center. So we have a wide variety of RNs, educators, administrators here today. So thank you, and thank you for your time in the middle of a Tuesday. So So at this time, I'm going to introduce Dean Kathy Rideout. And Dean Rideout has spent over 30 years and as a nurse administrator, educator, clinician, and scholar. And she's also led diversity and wellness initiatives in the School of Nursing, also leadership in redesigning and reimagining the School of Nursing and the new construction that's going on. And on a personal note, I'm happy that I had the opportunity to have her as my dean in my last year. Unfortunately, it's my last year in the DNP program, but at least I had that experience with her. We all know that going through these rigorous programs can really take a toll on you, and it's really great to have a dean that's in your corner and supports you, and also very personable. So without further ado, Dean Rideout, if you would like to give us some greetings and remarks.
Sure. Thank you, Kamila. It's so good to see everybody. And that is one of the best silver linings that we've talked about endlessly, is being able to connect with people across the country like we never were able to before. And so we've been having some, conversation with the dean, for other alumni, and really being able to connect with people across the country. And so some of those things, like Kamila was saying, there's some things in healthcare that are going to change post-pandemic that we have found has worked really well, like telehealth, for an example. But I think there are certain things that we're going to continue doing because it has allowed us to be able to connect and engage. I will just tell you very briefly, and Camille, I almost emailed you this, that one of our recent graduates that just graduated in December got a job at Northwell. And she just started her job a couple weeks ago, and her second day on the job, and she took a picture and sent it to me, was a picture of a sign that was on one of the entryways that said, "Thank you, University of Rochester nurses." And it gives me chills now. So she took a picture, she sent it to me, and she said, "Even at Northwell, they want to thank us." and so I shared with her that in the very beginning part of the pandemic, there was a team of nurses from the University of Rochester Medical Center that traveled to Northwell because they were really the hot zone, and to provide some care. And it was such a welcoming message for her, that sign was still there, and how meaningful that must have been to have that kind of support. And I said, we are everywhere. You, our nurses, are everywhere. And it just really brought a tear to my eye that was the first thing that she saw. And I was so thankful she snapped a picture and sent it to me, because then I really shared it across our school as well, because I think it's important for us to continue to remind each other how impactful our graduates are, but really even globally how impactful our school is. And so I will send you the picture, Kamila, so you can see it for yourself. But I will turn it over now to the panelists. I look forward to hearing from all of you.
Great and excellent. And feel free to send me her information. We can connect. We're all about networking here and keeping that stronger professionalism as well. So we're going to start with our panel. And let's start with self-introduction. So let's start with Mary Starks.
Hello, everyone. Thank you so much for joining us on this nursing Zoom call. So my name is Mary Starks. I am a nurse at Strong in the adult operating room. I graduated from the accelerated program at the School of Nursing in 2017. And I'm currently a graduate student finishing my master's as a family nurse practitioner and my doctorate of nursing practice. So I'm in my last year of my master's program, so this is great. I actually am a transplant to Rochester, New York. I'm originally from Los Angeles, California. I came all the way over here for school and decided to stay. And I am very happy with my decision. The School of Nursing has been very supportive in my education, as well as my additional extracurricular activities. So I am an active member in our Rochester Black Nurses Association, which is the local chapter under the National Black Nurses Association. I am one of the founders of the local chapter, as well as the first vice president. I just finished my 2-year term. And through this, I have actually been able to start a mentoring program for our APNN students, catering to especially our nursing students of color, just because we know that they tend to not graduate or tend to drop out of nursing programs, as well as they graduate and then they end up dropping out of their nursing careers after graduating. So our whole mission is to support both the Black community as well as our Black nursing students. So more to come when I talk about my silver linings, but thank you so much again for joining us.
Thank you, Mary. And now, Dr. Sue Griffey. Unmute yourself.
Thanks. I have the distinction, I think, on the panel. I know I'm the oldest grad by far, but I liked what Dean Rideout said about impact, because the last year that I was at school as a senior was the first year that Loretta Ford joined. And I became aware of the family nurse practitioner or nurse practitioners generally became one, and then went on to public health. But I always say once a nurse, always a nurse, because I started out in strong ICU nursing in that 90-degree weather with no air conditioning in the old building. Went on to clinic nursing, moved overseas internationally, then got into public health. And nursing was the base on which everything, including public health, my practice, helped me expand and deliver care in a variety of ways. And now, since I early retired a few years ago, I've been able to build up a mentoring practice, and I help a lot of people in public health who want to go into nursing. And I've been helping even some nurses you'll hear about soon, nurses who are in jobs and want to change jobs or even career focused. So it's been really wonderful. Thank you.
Great, thank you. And Sean Goonan.
Hey everyone, I'm Sean Goonan. I'm a 2011 graduate of the accelerated program. In a few short days, I'll be a graduate in the master's program, Adult Gero Acute Care Nurse Practitioner. I spent about 10 years in the finance industry prior to deciding to make a life and career change, and I was fortunate enough to make that happen at the University of Rochester School of Nursing. And since graduating in 2011, I've been at Wilmot Cancer Institute in some facet or another, starting as an inpatient nurse. And for the last 7 years, I've been a clinical nurse coordinator for the adult leukemia service. And in addition to that, I'm an assistant nurse manager in the clinic.
Great, excellent, excellent. Just great to hear what everybody's been doing since graduation. And that just epitomizes the slogan of ever better Melior. So excellent. So let's get started with the questions. So to the panel, let's talk about what are some life changes that has happened since the beginning of the pandemic. Mary, you want to start first?
Sure. So like I mentioned before, I am originally from Los Angeles. All of my family is all on the West Coast. So the hardest part for me has been not being able to see them for almost 2 years, going on 2 years. However, I do have to say that the Rochester community, both in the hospital and those I have met outside of the hospital, have taken me on as a family member. So I've been able to celebrate the past 2 years of holidays with people here. And that has been a pretty big change because I'm so used to being with my huge family back on the West Coast. However, I see that as a positive just because you have moved, and just the closeness of the Rochester community is a huge positive that everyone has been welcoming. So I feel like that was a really big part of my personal life.
Great, and Sean, would you like to answer that?
Sure. So for me, it was, I guess the life change was kind of adopting the mentality of not letting the virus or the pandemic defeat me or my family, like physically, psychologically, emotionally. So kind of going on the offensive and taking control of the situation, embracing it, embracing, mask wearing for our kids, and being creative with new ways to get outside and stay active, and not gain the COVID-19, but do the opposite and become more fit. And just really not take for granted just, going for hikes and things like that. So it just made me appreciate time with relatives and close friends more. And so I think that was kind of the biggest life change for me.
All right, thank you, Sue.
Yeah, I have two professional and two personal. The two professional are, I'm an early adopter of tech. So it was so great that so many other people got on board with ways to connect, which meant that because I'm not traveling now, I could expand my mentoring and almost double the number of people I help directly. The second one professionally is the Meliora Collective, and the expansion last year really opened up opportunities. Two different Rochester alum nurses found me, reached out to me, which for me is big on mentor readiness, mentee readiness. And I've worked with both of them. One successfully got a job last year for a variety of reasons. I actually wrote about her on the collective. She had an unusual career path. And the other one I'm working with right now. And personally, I learned that I could do teaching. I became a 1 day a week, second grade homeschool teacher for my oldest granddaughter, which required reminding myself that my mentoring practices need to inform second grade education. And the second is that my sisters and I, they're all in the Boston area, we're able to do, we've done now 50 1 to 1.5 hour recordings every week documenting our family history. So a big lot of silver linings. Thank you.
Yeah, and so one of the consistent things I'm hearing is having more time to do things that you want to do, right? So whether that's personal touch, like spending time with family, or fitness goals, or expanding mentorship opportunities, or networking, I'm hearing a constant theme of personal experiences. And I think that's also relevant because when we were shut down, we had a lot of time on our hands to figure things out, and less time commuting and being busy in our lives. So it really, in a way, some silver linings came out of that experience of having more time to ourselves. So in regards to skills in general, do you feel that you gain any additional new skills, or felt motivated to do something that maybe you weren't inclined to do before?
I do have to agree with Sue in terms of technology. That definitely has pretty much made itself present in all kind of facets of my life, especially in school. So at the beginning of my program, I had a degree plan that was set every semester. I was going to take certain classes, and the pandemic hit right as I was doing my health assessment class, which is supposed to be completely in person. We were supposed to have lab time with our classmates and practice on each other, practice on other patients, and that was not going to be feasible. So I thought that semester was going to be completely taken out, and we were just going to have to kind of do it all over again the next year, just because it's only offered once a year. So I thought my whole degree plan was going to be off by a year, but I have to give just amazing gratitude to the School of Nursing and all of their faculty. They came together very quickly to come up with a plan on how to keep students on track. So I was able to do my health assessment class and pass it and move on with the rest of my degree plan. And I still do feel confident in my health assessment skills. I was able to practice on people that I knew at my job, and we were able to kind of discuss the ways that we can do that. And this past semester, I have been able to do my clinical rotations, which have been great. One, which was, I would say, 95% telemedicine. And I think this is the way the future is going, especially to people who can't get to appointments at places that are very far or for specialty places. Telemedicine is going to be a way of the future. So not only being able to practice and see patients in person, but making sure that I'm able to give them the best healthcare over telemedicine has been really, really important to me.
Yeah, I think to echo what Mary said in terms of telehealth, we really had to embrace it, obviously. And the silver lining in that is that for a lot of my patients specifically that are severely immunocompromised, they don't feel safe coming to the hospital even now. So having the option of meeting with us from their living room is beneficial to them. And as well, we spend a lot of time building relationships with these patients, and occasionally they'll have to, they'll move to Florida to get out of the cold. And now the care that we provide can transcend geographic space. They don't have to have us help find them a new oncologist at their new location.
And I will echo that in terms of support networks. I'm able to now, because of the additional opportunities that this pandemic brought, forcing companies that provide bandwidth to expand, not just here, but globally. I achieved a personal goal of doing live one-to-many video support. I also provide support to doctoral students who want just a monthly check-in with the real world, not just their professor who has their doctoral degree in hand. So I think what we're hearing and seeing, universities have been bringing forward hybrid approaches. I do flipped mentoring, flipping the classroom work into your homework and then being in the classroom for real experiential activities, especially as Mary said, when you can't actually do hands-on health assessment. So I think those silver linings all bode well for opportunities, just our professional careers.
Great. Can you touch more about on the positives that come out of telehealth as far as being a provider and interacting with patients, and also, we have these ongoing issues of health disparities, and you mentioned, Sean, geographical disparities, so spatial disparities. So what are some positives that came out of doing telehealth in regards to you providing care for patients?
Is that, Dr. Barnes, was that to me or to Sue?
Anyone on the
To
panel.
anybody, okay.
Yeah.
So for me, I kind of already touched on it. It was giving the patients the option of whether or not they want to come into the hospital if they feel safe coming in during a pandemic. It's geographic space. It's more flexibility from a provider standpoint too, where if we're bringing patients in, just for like toxicity checks and things like that once a week, where they don't require a hands-on physical assessment, it's much easier to increase volume of patients seen. If you can do a quick 15-minute Zoom with them, you're still laying eyes on them, you're still able to go through a review of systems with them over the phone or over Zoom. So I think there's lots of benefits to telehealth.
Yeah, I definitely echo that. And I think even me as a provider seeing patients, I realized that my clinical skills are stronger than I thought it was, being able to manage a patient over video when we thought that everybody had to come in person. And many of the primary care complaints can be diagnosed and you send to the pharmacy and follow up, and that's it. Obviously, there's some technological disparities with connection issues, but besides that, for those who really have a hard time getting to the clinic, whether they don't have adequate transportation, it really connected us. So I think that's a great positive, and that's why telehealth is here to stay. So were there any other outside work that any of you did, like volunteer opportunities or, connecting with the community?
Before, I was saying that I am a very active member in our Rochester Black Nurses Association. I know Dr. Barnes is a very active member in her Greater New York City. We're sister chapters. I know that the Rochester Black Nurses Association, although we are very new, we're only 2 years into our being a local chapter. We saw COVID as an opportunity for us to pretty much make sure that we are doing what we said in our mission, which is supposed to be bridging the gap between the health disparities of the Black community and healthcare. So we actually received a grant from our national association to do some type of COVID project. So what we decided to do was create these COVID baskets. It had information on the spread of COVID, how to protect yourself, places to go get testing done. We put in like hand sanitizer, just personal hygiene items and things like that. And we actually delivered I believe like 10 or 12 baskets to elderly like apartment centers and communities, as well as homeless shelters. So that was one big project. And the other one was something called the Community Fighting COVID. It's actually a joint project with the Rochester Black Nurses Association, the Black Physicians Network, and Rochester Health, Strong, I mean, just a bunch of different people around the Rochester area. We set up pretty much in public places, tents where you can get a flu shot, you can get a COVID test. Eventually, we have started giving vaccines. That it's still going on. If you had COVID symptoms, you could go into a mobile bus and get a health assessment done. So just huge things. And I'm so glad that I've been able to be a part of those different projects.
Excellent work. Anyone want to add to that? Yeah, so thank you for acknowledging, Mary, the community work. I mean, currently we're doing collaborations in New York City with Community Healthcare Network to do vaccination pods throughout the city at churches in the community. So that's one of the main focus of connecting with churches, because people feel comfortable in the church that they go to get a vaccine, and we know that that's accurate. People want to be in their own comfort zone, especially when there's hesitancy or fears about getting the injection. So Sue, would you like to speak about programs going virtual and the future of programs going virtual, some of the positives we can look forward to?
Yeah, I think I'm happy to address that topic. I think that one of the important things that the focus has told us what public health is, which is nice. I don't have to explain to people anymore or try to explain what I did. And even more, everybody understands the variety of ways that nurses have interacted over the last year and a half. The ways in which nursing leadership and nursing clinical and technical areas have been demonstrated is just over and over again, from people's personal experiences with loved ones in hospitals or needing testing or vaccine distribution, to ongoing support networks. Hearing about ways in which nurses in neighborhoods would make themselves available for consultation, safe distance, but at least local care when we couldn't even go to the doctor last summer. Some people, there were clinics closed down for months. I think that the technology is now there where even my sisters, the two that are a little bit recalcitrant about technology, they can at least click on a Zoom link and know they're going to get through without too much of a problem. And that makes support networks really opportune for broadening interaction. So it's not just regionally based the way many of our networking opportunities and support networks were. Now we can have global communities where like-minded practitioners, for example, or people needing support can work. One of the things that I found very interesting this past since 2021 started, the Meliora Collective unveiled the full mentorship program for the entire university-wide students and early alums. And after a pilot program, I've been part of that, thanks to Jessica, who checked for me yesterday. 18 out of the mentees and mentors actually come from the School of Nursing. I was matched with someone that's in more global development work, but I thought that was a huge number, which is really great. I know we want to try to get our numbers up on the Meliora Collective, but it's also hard with platforms. Most people don't think to go to those places routinely. But I think knowing that the university and the School of Nursing have all of these opportunities available, the ways to connect available, I have to just recognize that a person on here, I was so glad, Michelle, when I saw your name, I thought, please let that be Michelle Young, who I went to school with. So the two of us are 73 grads. But just think about the ways in which we can collaborate for the advancement of nursing. It's not just our nursing donations, nursing school donations every year. And no one paid me to say this. It's the effect and the impact we can have on the next generation. Because frankly, I can't do as much as I used to. I'm not going to travel. I'm not the kind of, I'm not close enough to the school if I were working to provide opportunities for clinical. But now I know that I can contribute in a variety of ways that are meaningful to the school, and even more important, to our alums who are out working. So thank you for allowing me, Kamila, to talk about my soapbox.
Absolutely, absolutely. I want to highlight one of the things that you mentioned, and you said global, right? I think a lot of great things that have come out of the telehealth and the use of technology for teaching is having that global presence and global influence, and also collaborating with people outside of your town, outside of your state, internationally. And I think that is really priceless and something that should be continued. Even conferences, right? People zooming in from other countries. I mean, that's just amazing. We talk about dissemination of information and dissemination of our work, and this has given us a different platform. And we don't, almost like a TED talk, but right.
I like
that. So let's touch on Sean. I want to ask you about support. What is some support that you receive, maybe from your job, as far as supporting frontline nurses in their emotional, physical, and mental health?
So I think in terms of support, from a leadership standpoint, because I'm an assistant nurse manager, the focus really shifted to ensuring that our staff had the support they needed, not just, physical support like, supplies of PPE, but emotional support, a place to come into the office to vent, because everybody was scared initially. And then it was also about keeping them abreast of all of the different guidelines that changed on a minute-to-minute basis. So it shifted our focus from, it really just made us more cognizant of how much support these nurses needed, that were all of a sudden, masters of their craft are back to being novices early on in the pandemic.
Right, and I've definitely seen hospitals take initiatives like offering counseling services, or just spaces that people can just decompress, and so that's great. It's not just about, like you said, about PPE. It's about how are we getting through the day and balancing our family life, our personal life, and different things like that kind of can affect our overall health. So before we get into the Q&A, I have one last question to you all on the panel. Overall, what do you think are some silver linings in regards to your scope of practice and your personal goals, your aspirations, and your outlook on the future?
So I'll speak to it first. We already touched on, the bigger silver lining for me was really embracing telehealth from a provider standpoint, but also enabling our patients to embrace it, especially because, in the aging population, some of them are not as tech savvy as all of us are. So really helping walk them through that was a silver lining for me. And as well, like we already have all mentioned, was seeing our profession finally get the recognition that it truly deserves globally. I mean, I love driving around neighborhoods, seeing the support signs and front lawns for healthcare heroes. You know, kids wearing those "Life is Good" t-shirts that now say "Superheroes wear scrubs," things like that.
Absolutely. And they even did a beginning of pandemic in New York City, every at 7 o'clock, people will go outside and clap and
Yeah.
bake pots and pans if they were coming out on their balcony. You know, it was just really nice. It was just really nice to hear that. Any other thoughts or comments, Sue or Mary?
I think along kind of what Sean said, just recognizing the work that nurses do. And really also, since, you know, both Sean and I are getting into the nurse practitioner position, just being a provider and how much nurse practitioners are really engaged in family medicine and internal medicine, where we're seeing kind of a lack from the physician side. And we're kind of filling that in. I know Dr. Jane Tuttle will talk about, I am a student advocate in the Nurse Practitioners Association. And what got me interested in that was knowing that we're fighting for full authority in New York State still, even though the legislation has been granted a year to still kind of talk about the legislation and what it needs to be. I want it to be that, you know, when we graduate, of all the hard work that we've put in, we are able to be full independent providers as promised. And, you know, state legislation is not going to change that. So I think with the pandemic, seeing what nurses and nurse practitioners do for the community, I think hopefully that changes, you know, legislators' minds that we are a very, very important part of healthcare, and for our patients and for the community.
If I can just offer a couple remarks, Kamila, I love being reminded of all of you who are finishing your practitioner programs. That's just great. But I realized that my hope early on in practitioner work is still yet to be achieved. And that is, as you were referring to, Mary, you know, the full practice authority, but not just that, that people, I think a lot more people, including my husband, are comfortable going to nurse practitioners. But by the same token, to be able to finally have a place in the healthcare systems that is recognized that actually nurses are better at some things effectively, behavior change, making sure pain management is going well, and the like, are even better than the physician who needs to be in charge of it all. And I still haven't quite seen that revolution, but I'm hoping between the pandemic, public health, and the proliferation of nursing needs that are coming full force. They're coming to the fore, especially after the last 4 years of fighting opioid epidemics, all the chronic diseases, and now the pandemic on top of it. I think nursing is ripe for claiming hopefully an even bigger place. And I know that includes the pie in the sky, getting reimbursements from insurance providers, getting a wider latitude of authority like you were referring to. But I just wanted to put that out there because I realized as you all were talking how much I had hoped to be actually working in that environment, and we're still fighting that fight.
Great, thank you all. And now we'll head into the Q&A to the audience that are here today. So we would like to hear from you. You know, what are some silver linings for you, or what are some things that you took from this experience and getting through this pandemic that you think really worked well for you?
I can start. I'm Bill Bodeker. I graduated in 2004 from the FNP program. And during the bulk of the pandemic, I was the advanced director for director of advanced practice nursing for Mount Sinai Hospital. So we had 550 advanced practice nurses. And what I learned very quickly, and I grew as a leader in that, kind of supporting the staff just meant information. And I was very used to being very polished or trying to be very polished about what I sent out. And I realized that that wasn't going to work because the information changed so quickly. And so what I ended up doing is having a daily 20, 30-minute Zoom call. And sometimes it was 300 and something people on it, and sometimes it was 30, but I did it every day. And it was one of these things where, join if you wanted to. And then later on, many months later, people would come to me and thank me about how great that was. And I felt, personally, it was some days useless because I felt like I didn't say much. But what the feedback I got was just having someone that was on a daily basis, there, present, representing the advanced practice nurses and feeding that information proved to be very, very comforting, and it was very helpful. And my takeaway from that was, sometimes that's it, right? It's just being in that role, being an advocate, sending and forwarding information as soon as you get it, and being transparent. So I certainly learned that, I've definitely taken that, and we'll use that moving forward.
Absolutely. That's great reflection. And Jane?
I think the silver lining for me has really been to see all the wonderful contributions that our current students and our graduates have been making. I know, Kamila, it was such a pleasure to work with you when you were here with your DNP project, having to do with school-based health and all the things you've used your DNP for, including educating others and all of these continuing education offerings that you're putting together. It's awesome. And Mary, it's just such a pleasure working with you too. We were delighted when Mary accepted our invitation to be part of the NPA board. The Region 2 of the Nurse Practitioner Association was wise to invite her to join us to be she's already a huge leader, but to tap into some of her leadership potential. She's already presented to the students to get them to join and get them on board with all of the great things that we're doing. So it's just been a real joy to watch what nursing is all about and what our graduates, and you, Bill, too. I remember you very well from the program, and seeing everybody making their huge contributions to making the world a better place currently and then post-pandemic. So thanks.
Thank you, Jane. Anybody else want to talk about their experience?
Yeah, Camilla, I'll just share briefly. I had the opportunity to do it was a brief television interview. And it was myself and one of our graduates that was working in the ICU. And as she was explaining, it was really in the midst of the early parts of the pandemic. And in the interview, she had shared that she needed to postpone her wedding. She had a destination wedding that was planned. I think it was in one of the islands, and they needed to just cancel it because that wasn't going to happen. And she just matter-of-factly said that in the interview. So afterwards, I said to her, I said, I can't believe that, that you've canceled your wedding, and what are the plans? What are you going to do now? And she said, she said, Kathy, she said, I'm not even thinking about it. And she said, it's just a wedding. I have lives to save. And it just gave me chills and, brought tears to my eyes that was her passion. Like nothing else mattered to her at that point in time. She was in it, and her role right now was to save lives. And that was just so inspiring to me that, she's a young woman. This was a destination wedding. There was a lot of money that was already put out in this. And to her, it was like, I don't really care. I need to save lives. And I just thought that was just so inspirational for me to actually hear that from a young graduate, that's what her focus was right now.
Great story. Thank you, Dean Rideout. Anybody else want to discuss? And also, or if you have any questions for our panelists, please do ask now.
I'll just ask a question.
Sure.
So, I know, Sue, you were doing most things remotely. But I know, Sean and Mary, were in the hospital. And I felt very safe being in the hospital seeing patients because everybody was behaving. But what were some of the fears that you had really being on the front lines? Like, and how did you deal with those fears?
So I can speak to that a little bit. First of all, I would not consider myself to have been on the front lines any way, shape, or form in the ICUs or in the emergency rooms, et cetera. But for us in my outpatient clinic world, the fear was, when you're working on an inpatient unit, for the most part, you're going to know who is COVID positive. For us, our patients are coming in from the outside environment every day. And aside from, the screenings that we were doing at the door, we really didn't know what we were walking into. A lot of these people were asymptomatic. We didn't know a lot about it early on last March, April. So I'd say the biggest fear for our staff was physically going into a 10-foot by 10-foot exam room with a patient. Even everybody's masked, you still don't know what you're walking into and what your risk factor is.
I would have to agree with Sean. I wouldn't say working in the operating room, it wasn't like being in the ED or the ICU. It was we're in a very controlled environment. However, we did have those emergencies where, the person wasn't COVID swabbed and it was unknown. And so, you had to wear the, entire PPE garb and everything. And I think the fear was just protecting yourself, your other coworkers, and making sure that you still carried out the entire surgery as safely as possible, while protecting everyone who was participating in the procedures. Outside of that, I think every COVID person that I saw, it was a reminder, just about everybody else who was, outside of the hospital, just kind of going about their daily lives, that they could end up in the same situation in the ICU, family members, things like that. So I think it was, seeing, you see it and that it's real, and you're, I think we always talk about this where we're telling the community who was believing that COVID was kind of a hoax. It's not, it's not a hoax. It's real. These healthy individuals are on ventilators. They're fighting for their life. And we saw that it wasn't just about the respiratory system. There was, the vascular disease, the cardiology. We're seeing, clots and, ongoing health issues that are like kind of remnants of COVID. So I think it was the fear that we hope that people are taking this seriously, and, we're seeing it firsthand.
Great. Yeah, I think also Dean Rideout mentioned about fears, anxiety, and just the emotional piece of providing care. It was very challenging to just abruptly change and not know that, when you come out of nursing school, right, you expect that you're not going to know anything. But I mean, you pass your boards, but you know something. But you expect that uneasy feeling. And then when the pandemic hit, you had 10 years, 20 years, it didn't matter how many years under your belt. We all felt uncomfortable and felt like we were the small fish again in the big pond. And for some people, some nurses, that was really difficult to go from, I'm the master of what I'm doing, to, I don't know what I'm doing and I need to ask for help. But I think that contributed to a lot of collaboration, right? One of the courses that I took, rest in peace, Dr. Ingersoll, was the interprofessional education. And I feel like that really came out with this pandemic, people working together, just focusing on what's needed and also supporting each other, right? So outside of work, there were people, staff that got free food to keep them running, free masks from people who were making masks in the community. Just everybody working together in the hospital and out the hospital. And so I feel like it really enhanced interprofessional collaboration in that aspect.
Yeah, Camilla, when you mentioned food, I just feel like I have to brag a minute here. And so, as there was really an outpouring of community support for our healthcare workers, right? Donating, different things to healthcare workers. A lot of food, was being delivered. But the RBNA, which is what I want to brag about, they provided food for our housekeeping staff and our dietary staff. And so, they use some of their funds, and I'm forgetting Healthy Choice. What was the name of the food truck?
I think it's called it's something like Healthy Choice, but it's the whole premise is it's healthy garbage plates.
Healthy garbage plates, right. But I forget what the name of the company is, but they use some of their funds to, and again, I choke up a lot of these things, so I'm sorry, but they provided, almost 100 meals. It was like 65, something like that, meals to the other frontline workers that I think were being ignored, that because they weren't nurses, they weren't doctors, they weren't respiratory therapists, but they are the ones that were endangering themselves, going into patients' rooms, cleaning the rooms, bringing in, the diet, whatever their nutrition, whatever that was, and recognizing that the majority of our dietary staff and our housekeeping staff are from underrepresented groups. And really stepping up to do that. That just warmed my heart. I couldn't have been prouder of the RBNA for doing that.
That is amazing. I just love to hear the community collaboration. And in addition to that, there was even here in New York City, some hotels that were offering rooms to frontline workers because some of them were terrified of spreading COVID to their family. And I've even had some students that had COVID who were isolated from their family. And so all of that, those little things like Bill had mentioned, he realized just being there and being supportive was all that people needed. He didn't need to be polished and, sit here and cross T's and dot I's. That wasn't what was important at the time. So, yeah, that support is amazing. So now we're leading up to closing remarks, and we want to thank everybody for the time. But before you all leave, just want to say there are many ways that you can support the School of Nursing, and that's going to events like you're doing today, spreading the word, resharing on social media, encouraging a participation in events and attendance, making a gift for scholarships, research, and towards Helenwood Hall developments, so providing monetary donations, volunteering for various events, so serving on a committee, or becoming a mentor, and also joining the Meliora Collective, as mentioned earlier, the School of Nursing group, and that network. There are some upcoming fall events, which you'll get more information about. We all know about Meliora Weekend, so you'll get more information if it's going to be in person, virtual, or hybrid. They have the annual Claire Dennison Lecture, the annual DNP Summit, and also conversation with the dean, which is updates on to alumni and School of Nursing initiatives. So also Jessica put in the chat that she wanted to share some positive news announced in April by the School of Nursing. Today, in recognition of National Nurses Week, 3 of our alumni are receiving the Rochester Business Journal Healthcare Heroes Award, and a warm congratulations. So you can click on that link. Click on that link for more information. I just want to give a special thanks to our panelists, Sue, Mary, and Sean. Amazing. And thank you for your time, your insight. Thank you for everything that you do and you give of yourself. Outside of just going to work and coming home, you really give a lot of yourself to your colleagues and your community, even when you needed some support, right? So that's just, to me, says a lot about who you guys are. So thank you for your work, and thank you to School of Nursing for allowing me to host this event. It's been a pleasure. And thank you, Dean Rideout. Thank you, Melissa and Jessica, organizing the events behind the scenes, and Andrea as well. The last time I saw Andrea and Kathy was in New York City, And I definitely missed that. That was pre-pandemic. So hopefully one day we will get back together
We
again.
promise you we will. That was fun.
Fast as possible.
Okay, everyone, if there's no other comments or questions or anybody else need to speak before we end?
Yeah, just real quick, thank you so much. This is Jessica from the Alumni Relations team, and thank you so much to Kamila and of course the panelists, Dean Rideout, a very, very nice, good interaction in terms of all of the feedback that we've been hearing and a lot of different new experiences that I hadn't heard about. So it's just so important to have that insight. So we really appreciate your time and certainly sharing your experiences and so many good positives, so much good came out of this. And it's really nice to be able to really highlight it and focus on it and build on what was learned for the future. One thing I just wanted to remind everybody of is that the Meliora Collective the link is actually right in the chat. It's also going to be sent in the thank you email that's sent out to everybody after this event. We really encourage everyone to share, spread the word, really encourage people for the mentorship program and to join on. It's a great networking tool. Jobs are posted there all the time. So we really want to spread the word, and happy National Nurses Week. And definitely thank you for all that you all do.
Thank you all. It's good seeing you.
Thank you all. Have a good day. Have a great week as well. Enjoy the rest of Nurses Week.
Thanks,
Bye-bye.
Camilla.
Thank you.
Bye. Thanks, everyone.
Bye.